morning, Dr. Palermo with this week's Motivational Monday. The pandemic has affected us in so many ways, and one way that we are starting to see is the effect on our mental health. America already was struggling with mental health. In fact, over 50 million people are already on some sort of psychotropic drug. That's a 400% increase since 1994. In fact, 1 in every 4 women over the age of 40 is on some sort of psychotropic drug. It's kind of crazy when you think about it. We are so readily giving drugs that may not actually be serving us well. In fact, these drugs were never designed to be used for more than 6 weeks at a time, and they don't have FDA approval to be used for longer than that period of time. However, many people continue on these drugs for years. As hard as the stressors are with COVID right now, before you consider going on a drug, you want to consider what some of the long-term and short-term side effects are. Some of the conversations that don't happen with the doctor before you go on the drug are what some of the side effects are, including weight gain, sometimes up to 20 pounds within the first 3 months. Wouldn't you want to know that before you decide to take a drug? More importantly, because these drugs were never designed to be used long-term, we now understand the long-term effects like withdrawal symptoms and also sexual side effects that occur even after the drugs are discontinued. Like many other chronic illnesses, mental disease appears to have root causes. And so as you're struggling through this pandemic, if you're finding you have increased anxiety or depression, think about the root causes. Think about those foundational things. We're really going to explore this a lot in the next month, and so definitely watch out. But things like a poor diet that's high in sugar, those sugar swings that affect your microbiome, which definitely affects your serotonin and GABA production, can cause micronutrient depletions like low B12, low vitamin D, low omega fatty acids, low magnesium, which is associated with depression and bipolar. So there are many things that are foundational, and so you want to look for root causes. You want to move, you want to sleep, and you want to eat well. Start there before you consider going on a medication that may be with you for the rest of your life. That's all for now, and definitely watch ahead for some upcoming things we have to help you with some of these things when it comes to your mental health. Take care.